All right, everybody, welcome to another podcast for Be Vital. I'm your host, Marcia Hawkins, today, along with Stephanie Nascimento, the owner of Be Vital. And I'm excited to talk to you today. We talk a lot about peptide therapy, and I want to talk today about everything you wanted to know about peptides, but were afraid to ask. So welcome aboard, Stephanie. How are you today?
I am doing fantastic this morning. Thank you, Marcia. Thank you for having me.
Well, I always say the paths with people that you meet along the way are extremely intentional. And I am so grateful that our paths have crossed. And I don't even remember how our paths crossed, but it doesn't matter at this point. I'm so grateful. I'm very grateful for you. I'm just amazed at your wealth of knowledge and your information. More importantly, your passion for what you do. While I'm not in the medical profession, I am definitely aligned with functional medicine and wellness and everything that's good for us. We use the car analogy all the time on the podcast that it's the only vehicle we're going to get to take us through life. And I love to be a conduit or a provider of information for people that want to keep their vehicle in top working order. So peptide therapy is out there. Most everyone knows about peptide therapy, but a lot of people really do not understand how they work and all the benefits that come along with it. But more importantly, today I want to talk about some of the potential side effects that people get with them and how to avoid it or at least minimize it, because I think a lot of times people hear the good side of the peptide therapy, and there's a lot of good there. But there are people who have gone on them and maybe didn't adhere to their practitioner's advice on what they need to do to maximize the benefits of it, but also how to minimize the potential side effects. So I want to talk about that today because I think it's important. I know people have those questions, but more importantly, if they get on them and they do start to experience some mild side effects, I want to be able to address that. So let's just rip that Band-Aid off.
Great idea. It's a great topic to talk about. And I agree with you. We hear the snippets. We hear two ends of the spectrum, right? We hear all of the great side effects that can come that are not even expected, which is a beautiful thing. And then the side of the weight loss piece. And you have the other side, the extreme poor side effects, such as nausea and constipation and several others. And we don't talk about the in between, like how do you manage that? And most of them are very preventable and very manageable.
Great. So you mentioned the constipation, you mentioned the nausea. Are those like the two typical ones that people would feel? And do some people not get any side effects?
Yes. Yes. Some people have no side effects, no poor side effects like constipation and nausea. Headache is another one that can happen, but that is often associated with detoxing from some of the poor foods that they were eating. So that is GLP related, but also can be detox related.
What about dehydration?
Definitely dehydration can occur. And that's something I warn everyone that walks into the clinic about. And that is obviously very preventable, but you have to be diligent about your water consumption on the GLP because of the gut brain connection on this medication. It doesn't only shut off some of the food cravings, it can shut off the thirst center or at least disrupt it. So being diligent about your water and your electrolytes is something we drill into our patients to prevent that. And that it's very easily preventable. And if you're experiencing a headache, something as simple as putting some salt under the tongue and following it with 8 ounces of water takes it away within 5 minutes.
Oh, wonderful. Wonderful.
Yeah.
So typically you mentioned that not everybody does have the side effects, but so typically what would cause one to maybe get the nausea or the constipation? Is it directly tied to lack of fluid consumption? Is it not eating the right foods? Like what typically would set somebody up for a potential side effect?
Oh, great question. Great question. So, I believe understanding how the peptides work is integral to preventing these side effects.
Hmm.
Understanding what they do in the body, the connection between the gut and the brain, and how that works is really important because it is very much related to the mechanism of action of the peptide. It does slow everything down. So once you understand, okay, it's going to slow everything down as it's coming into my body, food, water, alcohol consumption, anything that you're going to consume in a day, that's going to be in a slower transient process in the body. And that's what can tend to cause some of these side effects, including the nausea. One other side effect that is related to the nausea in the GI system is heartburn. So, both heartburn and the nausea can be related to that slow digestion, lowering your digestion a bit. So, eating smaller meals, consuming small meals throughout the day, which is a great way for us to eat going forward, even in your maintenance.
Can I interject
Yes,
real quick?
of
I have a quick
course.
question. I don't want to
Sure.
forget it. So you mentioned eating small meals throughout the day. How does that tie to your blood sugar spike?
It is going to reduce a larger insulin spike. If you have a large meal, your body has to consume that within a certain amount of time, right? If it's going through your system if at a faster rate. So that is going to spike your insulin pretty high. And the job of insulin is to either break down the food and create energy out of that food or deposit food in the fat cells. So if you're consuming a lot of food at one time, and your body's busy shooting out that insulin and working that insulin, it's only going to be able to create so much energy out of it. And all of that excess energy and insulin spike, because you're spiking it a little higher with a bigger meal, it's going to use its other mechanism of action and deposit fat.
Got
So
it.
that is sort of the pathophysiology around it, but it
Perfect.
definitely spikes your insulin higher. Yes.
Okay, so eating small meals throughout the day. Yep.
Eating slower, which affects your overall digestion. Excuse me. There's something a while ago that was very popular, and it was the Fletcher method, which is chewing 100 times per bite. Now, that's a lot for anyone to do, but eating slower and chewing more will help your overall digestion. So that is something, all of these things that I'm mentioning right now, the reason why I'm explaining it the way that I am is because it not only is going to help you reduce and minimize side effects while you're on GLPs, but it's also going to help your overall health.
Well, that's interesting because when you think about it, whether you're on the GLP-1s or not, you should adopt that practice. Go to a restaurant, people inhale their food and out the door they go. And I wonder sometimes if people are even tasting what they're eating.
Right.
You know,
Right.
I mean,
Yes.
we're not the healthiest. Let's call it what it is. We're just not.
Right.
Our
Right.
diets are not. I think I talked about this on a previous podcast, how I know a lot of people that, work 9 to 5 in an office and they get up in the morning, they eat something, then they grab a bagel and a cafe colada on the way. They eat that, then they get to work and, oh, somebody made brownies and, oh, I'm just going to have a little nibble of one of those. And then it's lunch and all the girls decide to go out for lunch and French fries and hamburgers and whatever. And
Oh,
then
yeah.
they grab a snack in the afternoon. They'll get their afternoon coffee and they'll grab maybe the other half of the brownie. And it's just, it sets people up for failure. I just sometimes want to shake people and go, no, don't do
I
it.
know. I
But
know.
it's not their fault. It's
No.
it's it's become widely accepted. What did they just recently do? They just redid the food pyramid, and that's another whole
Right.
podcast. But I really hear what you're saying, but it does beg the question though, how many people eat like that, not on a GLP-1, are constipated and or have nausea and heartburn, really, when you think about it.
Absolutely. Absolutely. Yes. And to your point, what you just described, how some people do consume food, they're very disconnected from their food. And many of those folks walk into the clinic and I ask them what they eat in a day. And if you ask that person that you just described at the end of the day what they ate, they probably couldn't recall it because they weren't really present during the process. And we should be present and aware during our eating. I mean, this is such a important part of living and choice. You should not be doing this unaware.
Agree.
Yeah. So I do like that this eating GLPs or consuming GLP via injection or oral, or they even have drops now. But being on GLPs, it kind of has this behavior. If you're going to do it right, it builds in a behavior modification. So that is very important in any kind of lifestyle change that you make, and definitely crucial in any wellness or things that you want to incorporate into your life to benefit your overall healthcare. Behavior modification has to be a part of that, right? And in order to do beyond GLP medications properly, and get the most out of it with minimum side effects, you have to have that behavior modification, and this is already kind of built in.
Well, that's interesting. So I two questions on that.
Yes.
The efficacy of the injections, the pills, or the drops, all the same?
No, unfortunately, it is a little bit different because anything that we're taking in by mouth is going to interact with our gastric juices, and we don't know how assimilable that's going to be for each individual because that environment in the gut is different for everyone.
Makes
So
sense.
yes, so the GLP dosing on anything that's oral, so the drops included, the drops get absorbed in the mouth and the mucosa, so there is better absorption there, but the dosing has to be higher for the oral pills to counteract, unfortunately, what the environment is in their gut.
Right. So it sounds like absorption. If you're not absorbing it, you're not going to get the same effect. That makes sense. Totally makes sense.
Yes,
So you talked about behavior modification. Just want to touch on that a little bit. So there's some reports out there that some of the addictive behavior, whether it would be alcohol or food addiction, that this really might be long term a solution for that.
absolutely. And I love that connection. We do see that a lot with other medications, that their off-label uses can be for cravings and addiction. And there's some combination drugs that are used for that as well. Like low-dose naltrexone is used in that way. GLP are a shining star right now in terms of addiction, and that is very promising.
Yeah, I've read quite a few studies on. I have a friend who's a doctor down in Providence, and we were talking about that the other day. And she said that some of the studies that she has read are looking like there's going to show some promise with that too. So
Yes.
in summary, Stephanie, it sounds as though, and again, correct me if I'm wrong, but some of the potential side effects that you might experience with a GLP-1, such as constipation, dehydration, nausea, headache, realistically, you might be experiencing that with a poor diet as well.
Absolutely. Yes, 100%. A lot of those symptoms are very common in folks who are eating poorly, and then they do not have a good working digestive system. So a lot of these are going to be side effects from that as well.
So this is why the coaching that we can provide to people prior to them going on the GLP-1s and getting their body prepared for a good outcome and minimal side effects sounds crucial.
It is crucial. It makes such a difference in their results, their weight loss goals, as well as how they feel during the process.
Excellent. All right. Well, we should really talk about maybe doing another podcast regarding some of the behavior modifications that might be a potential good side effect, what we just talked about,
Yes.
whether it's alcohol or food or any other type of addictive behavior, whether or not maybe the silver lining with the GLP-1s is going to be just another whole avenue protocol for people who do experience addictions alive and well in this country, and I'm sure everywhere else. But it would be interesting to see if long term that becomes one of the potential benefits of it. So wonderful. So we'll do another whole podcast on that. All
Thank you.
right, everybody. Stephanie, if you could just tell people how to get in touch with you, that would be great.
Sure. We are, so the Be Vital Wellness Clinic, or Be Vital, is in Hadley, Massachusetts. Is 226 Russell Street, Hadley. And our phone number there is 413-387-0219. You can also check us out online at bevitalwellness.com.
And we'll also place the links in the podcast too, so people can directly link right to you. And I would
Wonderful.
assume just because we're where we are in Massachusetts, though, but if someone's out of state, highly recommend doing a phone consult or filling out a contact form on the website, Be Vital, and talking with Stephanie to see what she can do for you. All right,
Mm,
until next week, make it a great week.
thank you.